How to treat asthma attacks. Asthma is caused by an inflammation and obstruction of the bronchial tubes. The tubes can help the inhale and exhale air lung. During an asthma attack, the muscles around the bronchial tubes tighten and swell, which narrows the air passages and makes it difficult thus for the person to breathe. Common triggers of asthma attacks include exposure to an allergen, like grass, dress, pollen, etc., irritants in the air, such as smoke or strong smells, illnesses, like the flu, stress, extreme weather conditions, such as extreme heat, or physical exertion and exercise. Recognize early symptoms of an asthma attack. People with chronic asthma may wheeze and occasionally require the use of medication to control their symptoms. Recognize the onset of an asthma attack. An asthma attack can deteriorate into a life-threatening situation that requires immediate medical attention. Know how to identify an asthma attack so that you can begin treatment as soon as possible. Although signs and symptoms of an asthma attack vary depending on the person, the most common symptoms include wheezing or whistling while breathing. Most often the wheezing is heard when a person is breathing out, exhaling, but can sometimes be heard also when they are breathing in, inhaling. Coughing. Some sufferers may cough in an attempt to clear the airway and get more oxygen into their lungs. This may be aggravated especially at night. Chest tightness. Attacks are often accompanied by a feeling chest feels tight or there is pain on the left or right side. Know the symptoms of asthma in the child. Children will have the same symptoms often the adults with asthma, such as wheezing or whistling when breathing, shortness of breath, and chest tightness or pain. Fast breathing is common in an asthma attack in children. Children may show retractions where you can see their neck pulling, belly breathing, or their ribs when they breathe. Evaluate the specific situation. Assess what is happening to determine if emergency medical attention is needed and what treatment should be done at the scene. Have an action plan in place. Once you are diagnosed with asthma, create an asthma action plan with your allergist or physician. This plan is basically a step-by-step process of what to do when you face an acute attack. The plan should be written down and include emergency phone numbers as well as those of family and friends who can meet you at the hospital if needed. When you get the diagnosis, consult with your doctor to identify your particular symptoms of worsening asthma and what you should do when they flare up, e.g. take medication, go to the emergency room, etc. Avoid your asthma attack triggers. In general, note prevention of symptoms is the best way to manage and treat asthma. If you know what your situations trigger asthma attacks, such as being around furry animals or extremely hot or cold weather, then try to avoid these when possible. Get the inhaler prescribed by your physician. There are two different types of rescue medications that you may have been prescribed your doctor, a metered dose inhaler, MDI, or a dry powder inhaler, DPI. MDIs are the most common inhalers. They deliver asthma medication through a small aerosol canister equipped with a chemical propellant that pushes the medication into the lungs. An MDI can be used alone or with a breathing chamber, spacer, that separates your mouth from the inhaler, and which can allow you to breathe normally to receive the medication and help the medication get into the lungs more efficiently. DPI inhaler means of delivering dry powder asthma rescue medication without propellant. Brand names of medications DPI include Flovent, Serivent, or Advair. The DPI requires you to breathe in quickly and deeply, which makes them difficult to use during an asthma attack. This makes them less popular than the standard MDIs. Whichever you have been prescribed, make sure you are always carrying it with you. Use the MDI. Note when suffering an asthma attack, you only want to use an MDI filled with a rescue medication, bronchodilators, such as albuterol, and not corticosteroids or long-acting beta-2 agonist bronchodilators. Shake the inhaler for 5 seconds to mix the medication in the canister. Before using the inhaler, push out the much air in the lungs as you can. Lift your chin and seal your lips around the air chamber or the end of the inhaler. Using an air chamber, you would breathe and slowly normally to get the medication. Using the inhaler, start to breathe in and press the inhaler once. Keep breathing in until you cannot get in any more air. Hold your breath for 10 seconds and repeat at least one time, but more often, allowing at least 1 minute between uses. Always follow the instructions on your asthma plan. Use the DPI. IPRs consistently vary from manufacturer to manufacturer, so care shouldn't be taken in reading the instructions before using. Breathe out as much air as possible. Seal your lips around the DPI and breathe in strongly until your lungs are full. Hold your breath for 10 seconds. Remove the DPI from your mouth and exhale slowly. If more than one dose is prescribed, repeat after 1 minute has passed. Recognize an asthma emergency. If your asthma symptoms worsen even after taking your medication, you may need to get emergency medical assistance. If your breathing is too labored and you cannot speak clearly, you may need someone to call for you, such as a friend or family member nearby or to passers-by. A good action plan will include the site number for emergency services. In addition, your doctor will have you identify help when your symptoms are becoming more severe and when you are entering an emergency situation so that you'll know when to get help. Try to stay calm. Becoming anxious can increase your symptoms. Ask someone in the vicinity to sit with you to help you stay calm until emergency help arrives. Help the individual find a comfortable position. Most people with asthma will be more comfortable sitting and not standing or lying down. Keep the person upright to assist with lung expansion and ease of breathing. Let the person lean slightly forward onto you or a chair for support. Some asthmatics may sit in the tripod position by leaning forward with their hands on their knees to relieve pressure on their diaphragm. Remove all known triggers in the immediate area. Asthma is often exacerbated by specific triggers or allergens. Try to remove the trigger or remove the person from the trigger if it is environmental, like pollen, or weather-related, like animals, smoke, pollen, high humidity or cold weather. If the person does not have an inhaler, call emergency medical services, especially if the asthmatic is young or elderly. People suffering from asthma attacks without inhalers are serious risk of asphyxiating. Even if the asthmatic seems to get better after using their inhaler, it is best if a paramedic or healthcare professional can assess the person. Continue to help the person with their inhaler if necessary, even if the asthma attack does not decrease in the severity. Medication will help keep it from by relaxing the airways worsening. If at home, running a hot shower or bath can transform the bathroom into a good recovery zone due to the steam. Practice breathing exercises. Try pursing your lips as you exhale. This can help slow your exhales and keep the airways open for a longer time. Make use of common household drugs. Certain drugs may help relieve the effects of an asthma attack in the case of emergency, although they should never be taken in lieu of getting emergency assistance. Administer the fast-acting antihistamine, allergy medicine, if you or the asthmatic thinks an allergen has triggered the reaction. Be careful when using natural herbs or supplements. Some people are allergic to the ingredients. Use over-the-counter pseudoephedrine like Sudafed. Sudafed decongestant nasal is too, but it could help during an asthma attack when an inhaler is not present because it can help open the bronchioles. It's best to break the pill down with a mortar and pestle and dissolved in warm water or tea before administering to limit the risk of choking. Note as well while it does work, it can take up to 15 to 30 minutes to be effective. Keep in mind as well pseudoephedrine can increase the heart rate and blood pressure. Symptoms of asthma, such as coughing, wheezing, shortness of breath or chest tightness, are reversible with inhaled medications. In some cases, the reverse symptoms on their own. If you have been treating your asthma attack and it is mild, but not getting better, see your doctor to help prevent it from getting worse. He or she may prescribe oral steroids to help stop the attack. If you follow your action plan as soon as you start to have symptoms, you can avoid it often becoming a severe attack. Make sure your inhaler and any other medications you take for asthma are not expired or run out. Call your doctor if you need a refill before you run out if possible.